Hi, I'm Derek Bryan, the owner of Miramar Recovery Centers in beautiful Laguna Beach, California. The topic for this discussion is the different levels of addiction and dual diagnosis treatment. So often we get phone calls from people wanting to understand what the different levels of treatment are and what's appropriate for their situation. So I thought I'd spend just a couple of minutes here telling you about the different levels of treatment, which are essentially two levels. The first level is outpatient, and that's pretty self-explanatory. The patient lives at home, and during the day, either 1 or 2 or sometimes even 5 days a week for a certain number of hours, will go to an office building or to a clinic or some other environment and receive treatment. The second level of treatment, which is a higher level and which is the level required by most people with a serious addiction issue or a co-occurring disorder, that level is called inpatient level. Now, in the inpatient environment, there are actually two sub-levels. The first is true inpatient treatment, which would be a hospital or similar environment. In that setting, clients are in a hospital. They'll probably be in a room with at least one other patient. Doctors, nurses, a full staff on duty in very much a hospital setting. That's a less common level of care. The most prevalent and pervasive level of addiction treatment is the residential inpatient level. Residential because it's a residence. It's just like a home. In fact, they are homes that have been modified to be treatment environments. They'll have bedrooms and kitchens and living, dining, family rooms. Treatment occurs on site right in the home. And that is 24 hours a day, 7 days a week. So the patient doesn't leave. At least in our situation at Miramar Recovery, our clients are with us 24 hours a day. We go off-site regularly, but we go off-site as a group or with a staff member. So that would be considered residential inpatient level of care. And like I say, that's probably the most prevalent level of treatment. And those programs typically last 30, as a minimum 30 days, up to 60, 90, even 180 days. Just depending on the situation and on the clinical appropriateness. So hopefully this has been helpful for you. Thanks for listening. For more information on substance abuse and dual diagnosis treatment, please call us toll-free at 888-300-3210 or visit us on the web at miramarrecovery.com.